when living with an MPN, what are the expectations? I think that we all want to look forward and know exactly what to expect. But how would you counsel patients, and what would you say as far as the expectations of living with these diseases?
Mhm. This is quite important for patients, particularly when they first landed in a hematology clinic and have been given their diagnosis, and they want to know what, how will life be different now? And our goal, wherever possible, is that people lead a normal life and that this is just something in the background. Um, on a practical point of view, if an individual is low risk, and doesn't need very active treatment, but just perhaps monitoring, then what life might look like is, a normal, healthy lifestyle, but blood counts that get followed up by a hematologist. And those blood counts could generally be every 3 to 4 months. In many parts of the world, they can be done by telephone, reviewed by telephone, and done locally to the patient so that they can, as much as possible, carry on with a normal life. Even in patients who have low risk disease and aren't under active therapy, we do advise maintaining a healthy lifestyle. And this isn't just because it's generally good, it's particularly important in MPNs because in MPNs we're trying to prevent thrombosis, and these individuals are at slightly higher risk of thrombosis. So, what they don't want to do is increase that risk further by, for example, having a higher cholesterol or a high salt diet or high blood pressure, or untreated diabetes, or indeed being overweight or smoking. So, by managing those additional risk factors even more, one can overall protect themselves from some of the complications that their MPN may otherwise cause. So we advise those things for all our patients, including the ones that are at slightly higher risk. And depending on where you are, either your primary care physician or your hematologist will engage in monitoring some of those things like cholesterol levels, any diabetes or blood pressure. At the higher risk end of the scale, individuals may need more active monitoring. They may need titration of their doses of medication until we are achieving the response that we want to see. We may sometimes have to change medication or alter medication because individuals have side effects as a result of the medication or side effects from the disease that we're not managing to fully treat, and therefore we have to try alternative medication. And sometimes, if the blood counts show unexpected results, perhaps they've gone down or up, we might suspect disease progression, particularly if the patient also has suspicious symptoms, and then it may involve a repeat bone marrow biopsy or imaging. So, in terms of the practical sides of medical care, it very much depends on where on the spectrum an individual lies between the chronic low risk versus the active treatment and perhaps more advanced disease.
Yeah, on that, following up, I would a question I've always asked is how often am I going to need a bone marrow biopsy? Is that something you're doing regularly, or is that something that occurs just when necessary?
I would say this practice varies, but for most people, they will probably consider a bone marrow biopsy at diagnosis, although there are some centers and in some individuals where even that may not be appropriate. If for whatever reason, a bone marrow biopsy is not going to change anything and you already have clinched the diagnosis, and perhaps the individual is elderly or frail or doesn't want to undergo the procedure, provided it's not going to change what you do, it might also be acceptable to not do a bone marrow biopsy. But in the vast majority of cases, a bone marrow biopsy is part of reaching a diagnosis. And unless there are reasons where the clinician is worried that perhaps there are some features there that you may want to follow up on, generally speaking, most individuals have a bone marrow biopsy at diagnosis. Other times when they may need a bone marrow biopsy is if there's a suspicion that the disease has changed, either on the basis of the patient's symptoms or signs or on the basis of blood counts. And the only other time I think where bone marrow biopsies are sometimes repeated are on certain therapies. So, for example, some individuals may be on a drug called anagrelide, and that has been shown to cause a little bit of scarring in the bone marrow over time. And so sometimes some clinicians, if they're worried about that, may do a bone marrow biopsy, every 5 years to monitor for that or to monitor if things have improved.